I'm a mom on a mission, as you know, and I'm here once again with one of our wonderful super stroke heroes, Dr. Reichwein from the Penn State Hershey Hospital, as a medical center, I should say, as well as the rehab center. I mean, you do so much work back and forth with stroke patients, both through their journey of getting them stronger and also out of the hospital, and then continuing their journey here at the rehab center. So I was really fascinated to hear that there's a lot of emerging state-of-the-art technology, science, and even clinical trials out there. So I would love to hear more about that.
There's a few things on the horizon, not ready yet for prime time, but getting closer. The first is there are ongoing trials looking at IV stem cells within the first day or so after your stroke. And there's also a more recent study looking at implantable brain stem cells up to 5 years after the stroke, both geared towards enhancing neurological stroke recovery.
So what's involved with that? When you talk about stem cells and implanting them in the brain of a stroke victim.
So it does require a neurosurgical approach.
Okay.
And these stem cells, the more recent trial looked at implanting them around the older stroke area, and they seem to facilitate brain function. They don't create new cells, but facilitate the function of the brain, and even several years out can lead to improved functional recovery for some patients.
That sounds so promising, because I know folks have different levels that they come back after a stroke. And so science and the promise of science excites everybody at any age. Is any of this available around central Pennsylvania in that area?
So we're working on very soon trying to start some research trials at Penn State Hershey Rehab that would focus on that. We're also looking very soon to try and do a brain stimulator studies. There's also some recent work on something called transcranial magnetic stimulation to stimulate off the scalp region brain tissue, and some early data that may suggest in properly selected patients you can have improved speech and language and or motor function.
So when they actually stimulate the brain, what does that entail? What does that involve?
So again, it's all external, so the electrodes placed on the scalp or a coil just a little above the brain, a magnetic coil. You can stimulate positively or negatively brain tissue, and you can see a response. It's coupled to therapy, so these people still undergo physical, occupational, and speech therapy in conjunction with periodic stimuli via these devices.
So you're saying, for example, if somebody has lost use of, let's say, their arm, after doing something like this,
you can see improvement.
That is, I mean, that's incredible.
And a lot of the best literature is earlier on, within the first few months after. But both, there is literature out there in, again, properly selected patients that you can have improved speech, language, and or motor power to arms and legs.
So much promise with all this research, and that's why research is key.
Yes.
And I know we have to continue,
Yes.
Getting resources for research. Especially, I know you're really the leader trying to get all of that right here for folks in central Pennsylvania. And the thing is, people drive from all over outside of the area. I know you have folks that come 2 and 3 hours for all the wonderful state-of-the-art facilities, resources that you have available here. So talk to me too. The other thing you talked about before was adaptive gear or adaptive resources for those stroke patients who maybe want to be able to drive again or do an activity or live life to the fullest, right?
So there's a limited number of experts in the neuro rehab field, both therapy staff and physician staff. So via telemedicine or telehealth, we can now take experts to you. And whether it be in clinic facilities or perhaps at home, if you're interested in certain things as to maximizing your quality of life and function, we can bring physicians to you, physiatrists or neurologists, and also therapists. So there are people out there that can do home therapy. And again, the ultimate goal is to provide you with all of the available resources and or other ideas, devices, recreational therapy, resources, etc. And there are some cool adaptive resources so people can hunt, fish, kayak, and do other things that they would have never thought possible. But this allows everybody to, again, know from experts what the options are and see what best fits for them, ultimately maximizing their quality of life.
It's really exciting. It excites folks, you know, at any age, because everybody has different interests depending upon what their age is. The other thing is, I think it also would excite the family.
Exactly.
It would allow them to be able to continue doing activities and hobbies that they enjoy. So again, another key message I know that you really try to stress and do stress with all your patients is never lose hope. And why is that so important?
Because I do think there are futuristic things that will help at all phases of stroke and make their quality better. The other thing that is on the horizon are robotics and exoskeletons and other computer-based programs that, even if they can't regain the function on their own or with stem cells or the brain stimulators, our technology has advanced to where we will have ways to allow them to function better and enjoy life better. So I tell everybody, never give up. There is hope, and I do think the rainbow is bright on a rainy Saturday afternoon.
Well, you put a smile on our faces on more than one occasion. This is such exciting news. So again, I know that we can't stress enough. Don't give up hope. Make sure that you learn all the signs and symptoms of stroke. Be fast. Again, do you want to do a quick plug, one last plug for what that is?
So B-FAST is the acronym out there for stroke. So B is balance. So if there's a balance problem, unsteadiness. E is eyes. So you have a visual problem, you lose vision, or you have double vision, seeing two or more. And F is face, a facial droop, or numbness. The A is arm weakness or numbness. The S is speech, so a problem with speech, slurred speech, problems articulating the words, or confusion, understanding problems. And then lastly, T emphasizes time, that you call 911 and EMS can promptly take you to a facility and provide acute stroke care.
Well, thanks again. So be fast and tune in to what's going on around you, whether it's a family member, a neighbor, out in the community. Make sure that you know the signs and symptoms, and also check out some of the cool research that's on the horizon. Thanks again. We appreciate it. Another hug. You're a hero. Thank you.